This week was like many others. I had about 4 evaluations from people who got hurt by chiropractors. And one gentleman had to have 2 neurosurgeries because of it. And as a physical therapist, I'm kind of tired of people getting hurt by manipulations. So I want to give you a little background about my history. So I had a physical therapy clinic on the North Shore of Oahu for several years where I worked for the World Surf League. And I got to treat different surfers from all around the planet. And I also got a chance to work with different doctors from around the planet. And we saw a lot of different injuries. Some doctors believed in this and some doctors believed in that, from stem cells to alternative methodologies of care. And people always ask me, when should I not get manipulated? And that's what I want to talk to you today about. Injuries are more prevalent more than ever, and I suppose it's due to all the TikTok manipulations, the ring dingers and such. I got a call this week about someone asking me if they can do a ring dinger, a manipulation. It's like, yes, we are trained in manipulations, but physical therapists, doctors, DOs, we do manipulations or HVLAs for very specific reasons. And we follow these things called clinical practice guidelines set forth by the AMA, the American Physical Therapy Association, mostly when not to do a manipulation. Just because you know karate doesn't mean you should use it on someone. So, for example, if you're under 18, no manipulations. We're not gonna ruin your growth plates. If you're over 65, no, because you might have osteoporosis and might get a fracture. The thing I hand out to patients who get hurt by chiropractors is an article written by the World Health Organization. It's guidelines on basic safety and training for chiropractic care. Not all chiropractors are trained the same as they are in the United States, and there's a lot of wild things out there, so the World Health Organization had to get involved. And what I'm going to highlight is page 21 here. Absolute contraindications to spinal manipulative therapy. Some things such as fracture are pretty self-explanatory. Frank disc herniation with accompanying signs of progressive neurological deficit. So if there's numbness and tingling past the elbow or knee, we don't do it. Dislocation of a vertebrae, absolutely not. Internal fixation devices like mine in my neck or my back. And probably the most important is signs or patterns of instability. Any signs of patterns of instability. So sprained ankle, sprained knee, sprained shoulder, sprained ligaments in your neck or spine, don't do it. There's a lot of adverse reactions as well, and it's a big problem, but there's also other contraindications as well, such as bone weakening, destructive disorders, psychological factors, neurological disorders. These are all reasons why the World Health Organization has tried to step in and stop manipulations from occurring. So I know it's a lot to process, but I encourage you to read this PDF. It's really informative. If you have any questions, reach out. Until next time, stay safe. Aloha.